Today we're going to talk about a vital organ you rarely think about until something goes wrong, the liver, and whether it can be dying. We will review 12 early warning signs to watch for, what they mean, and when to act. You might ask, can a liver die? In medical terms, the liver can fail, either acutely or chronically, and when its function is severely compromised, many systems in the body begin to collapse. But before reaching that extreme, there are often subtle clues. Recognizing them early can make a difference. We'll move through 11 segments, or laps, covering how the liver works, definitions of failure, and then the 12 warning signs, grouped sensibly, plus what to do. Let's begin. Lap 1. Why the liver matters in compensatory reserve. The liver performs over 500 functions: detoxification, protein synthesis, like clotting factors, bile production for digestion, metabolism of fats/carbs, storage, glycogen, vitamins, immune roles, breakdown of old red blood cells, etc. Because it has huge reserve, a liver can compensate even when parts are damaged. That's why early disease is often silent. Only when damage accumulates, or a sudden insult occurs, do signs appear. When the liver begins failing, toxins build up, clotting is impaired, fluid balance is disturbed, and multiple organs get secondarily affected. Lap 2. What liver failure means. Acute versus chronic liver failure is when the liver cannot maintain its normal functions and the body starts to suffer. Acute liver failure develops rapidly, days to weeks, often in a previously healthy person, from a sudden injury, e.g. overdose, toxins, viral hepatitis. Chronic liver failure evolves slowly over months or years, often following chronic liver diseases such as cirrhosis, chronic hepatitis, fatty liver disease. Eventually, compensatory mechanisms fail. In chronic failure, signs often appear gradually and vary in severity. Because we want to catch it early, let's now look at 12 early warning signs, some subtle, some more obvious, that may indicate the liver is under stress or beginning to fail. Lap 3. Sign 1. Persistent fatigue, malaise, weakness. One of the earliest and most common symptoms is fatigue. Feeling tired all the time, low energy, general unwellness. The damaged liver is less efficient at detoxifying and regulating metabolism, so toxins linger, and energy production is impaired. Often patients dismiss it as stress, but when fatigue is persistent, unexplained, and progressive, it's a red flag. Transition. Fatigue alone doesn't diagnose anything, but if combined with other signs, the suspicion rises. Let's see another frequent early symptom. Lap 4. Sign 2. Abdominal discomfort, shock arm pain, upper right side. The liver sits in the upper right abdomen, under the ribs. When it becomes inflamed or stretched, you may feel discomfort, a dull ache, fullness, or pressure in that area. It's not always sharp, it may be vague or intermittent. But if this discomfort persists, particularly on the right side, it's a sign to pay attention. Lap 5. Sign 3. Digestive disturbances, nausea, loss of appetite, vomiting. As liver function declines, digestion is impaired. You may feel nauseous, lose appetite, or even vomit. Food may seem to sit heavy, you might feel bloated, or you may skip meals because you cannot eat comfortably. These are nonspecific. Many conditions can cause them, but in the context of multiple signs, they become meaningful. Lap 6. Sign 4. Jaundice, yellowing of skin, eyes. One of the more distinctive signs is jaundice, yellowing of the skin, sclera, whites of the eyes, and mucous membranes. This is due to bilirubin accumulating in the blood. When the liver can't process on dark skin, jaundice may be harder to see. Look at the eyes, the inner eyelid, conjunctivae, or palms. Jaundice is an early sign of impaired bile processing or hepatic dysfunction and is more alarming than some of the vaguer symptoms. Lap 7. Sign 5. Dark urine and pale or clay-colored stool. Because bilirubin spills into the bloodstream and is excreted in urine, one sign is dark, brown, tea-colored urine. Meanwhile, if bile doesn't reach the intestines properly, stool can become pale, clay-colored or light, lack of bile pigments. These two together, dark urine plus pale stool, are especially suspicious for a biliary, bile duct problem, or hepatobiliary dysfunction. Lap 8, sign 6, itching, pruritus, skin changes, easy bruising, bleeding. When bile salts build up in the circulation, they may irritate nerves and cause persistent itching without rash. Also, because the liver produces clotting factors, when liver function declines, you may bruise more easily, have bleeding gums or nosebleeds, or poor wound healing. Skin signs may also include spider angiomas, small spider-like blood vessels visible on the skin, palmar erythema, redness of palms, and blotchy skin. These are signs that small vessel changes and clotting dysfunction are beginning. Lap 9, signs 7 to 12, grouped. Swelling, weight, muscle loss, confusion, bleeding, vascular signs, muscle wasting. Here are the remaining signs 7 through 12 that often appear as disease progresses. Swelling, edema, ascites. Fluid accumulates in the legs, ankles, and belly, ascites, because the liver fails to maintain fluid balance and oncotic, unintentional weight loss, muscle wasting, malnutrition, poor protein synthesis, and catabolism lead to losing muscle mass and weight, confusion, cognitive changes, sleep disturbances. When toxins aren't cleared from the blood, they affect the brain, hepatic encephalopathy, leading to forgetfulness, memory loss, disorientation, mood changes, drowsiness. Bleeding, gastrointestinal bleeding, portal hypertension, and fragile vessels cause varices, dilated veins in esophagus or stomach that may bleed. Vomiting blood or coffee ground vomitus is possible. Vascular signs, spider vessels, caput medusae, palmar erythema, abnormal blood vessels on skin, dilated veins around the umbilicus. Reddened palms are signs of liver disease. Muscle cramping, tremors, neuromuscular signs, cramps, twitching, tremors. Asterixis, liver flap, may appear in more advanced dysfunction. Each of these may not appear in every patient or may appear late, but when several of them appear, the suspicion of serious hepatic compromise is strong. Lap 10, putting it together and differential considerations. At this point, we've covered 12 key signs. However, none of these signs are perfectly specific. Many can arise from other diseases, kidney disease, heart failure, gastrointestinal disease, etc. Clustering of signs, multiple signs in one person, increases the likelihood of liver involvement. The timeline matters. Gradual versus sudden onset may point to chronic versus acute causes. We must also consider risk factors: heavy alcohol use, viral hepatitis, fatty liver disease, obesity, exposure to toxins, certain medications. In assessing a patient, a clinician would correlate these signs with lab tests: liver enzymes, bilirubin, albumin, coagulation factors, imaging, and possibly biopsy or advanced imaging. Lap 11, when to seek help, diagnostic approach and prevention. When to see a doctor urgently: sudden jaundice, abdominal pain, confusion, vomiting blood, swelling, progressive signs like unexplained fatigue, weight loss, or persistent symptoms. Diagnostic steps by clinician: liver function tests, AST, ALT, alkaline phosphatase, GGT, bilirubin, albumin, PT/INR, viral hepatitis serologies, imaging, ultrasound, CT, MRI, autoimmune markers, iron studies, metabolic panels, possibly liver biopsy prevention and liver care. Avoid excess alcohol, maintain healthy weight, manage metabolic syndrome, vaccinate against hepatitis A and B, avoid hepatotoxic drugs or herbs without supervision. Regular checkups when risk present. Early intervention if disease is caught. So in summary, yes, a liver can die in the sense of failure, either acutely or chronically. But before that final stage, the body often gives clues. The 12 early warning signs we've reviewed: fatigue, abdominal pain, nausea, loss of appetite, jaundice, dark urine/pale stool, itching/skin changes, edema, weight/muscle loss, confusion, bleeding, vascular skin signs, neuromuscular signs. If you notice multiple of these in yourself or someone else, don't wait. Seek medical evaluation. Early detection can often allow treatment or reversal before the damage becomes irreversible. That ends our talk. Thank you for listening. Do you have questions or want to go deeper into any sign or diagnosis?